Here we go. All right, we're recording. Welcome to our October 2024 State TA Day webinar. We have a lot of exciting things to talk about. We know it's been a kind of a crazy adjustment-filled couple of months, and we really appreciate everyone's patience and bearing with us as we're experiencing change. So we are going to kick it off with a brief E&E update from Christy. So take it away.
Okay. Thanks so much, Charlie. Afternoon, everybody. It's good to be with you today and share an E&E update with you. Next slide, please. So the Salesforce update, we are taking care of all of the final details, crossing our T's, dotting our I's, having our contracted vendor check out things in the sandbox. We are running some test cases. And so I just want all of you to watch the chatter for updates. As soon as we get the green light, we're going to let all of you know. So that's the Salesforce update. In regards to E&E contract amendments, Bonnie and I are going to start working on those next week. And for those councils that did not receive the closeout form, you're going to receive a form from us for you to complete so that we can start working on your contract amendments, specifically for E&E. And then in regards to MOUs, we've got MOUs that went out before the Salesforce transition, and there is language on those MOUs that allows for the extension through September of 2026. I just walked with the council through that, and as I read the MOU, I was like, where is this? So I wanted to just talk that through with you. There is a footnote for any E&E MOUs that you've already received for providers. There's a footnote at the bottom that says that this contract can be extended until 3 months before the legislative authority ends. So the legislative authority ending period, that time period, is December of 2026. So with the footnote, it says 3 months before. So that means that the MOUs are effective through September of 2026. For the new MOUs that will go out once Salesforce is fully operational and the MOUs are sent out through Salesforce, those MOUs have been updated and it states through September of 2026. So just wanted to provide some clarification for you on that. And then we can go to the next slide. So we still are hosting office hours every Wednesday, 10 to 10:50 a.m. Feel free to join me there and ask all of your E&E questions. And next slide. And then Danielle and I are still accepting requests to transfer funds. So in this waiting period, if you do have applications that you need to move some funding around just a little bit, be sure to fill out that form, and then we'll take care of that for you. So that's all I have. I'll open it up to questions.
We'll just add a little bit. We just got off a call with our development team on all the E&E stuff, and unfortunately it's a third of the councils. It's like 11 councils that are impacted by a problem we have with the coaching rate. So we continue to work, and we do believe we have a solution. So I apologize again for the crazy time gap we've got in here, but we're throwing all of our resources at this right now. So
thank you
looks
for
like
that.
Julie has a question.
I do. I have a couple actually. my main question is that footnote in the contract as well, or is it just because the MOU is not part of the official contract? So I know it's in the MOU, but is there a footnote in the contract around the E&E?
You're going to be getting a new contract.
Well, I am sure I am.
Well, you know, things roll out a little slowly around here, unfortunately. But yeah, we're getting those amendments moving out probably within the next 2 weeks, I think. So it'll all be updated there, Julia.
It'll be there before December, right?
Uh-huh. Yes,
This is just coming from our business services side. Is just I want to
of
make sure
course.
everything is aligned because our current contract ends in December.
Yeah.
Okay, perfect. Thank you.
And I saw another hand.
Yeah, Lisa.
You know, I raised my hand, but then I put it back down. But I was just wondering if there was any possibility the issue for our Weld County being one of the areas having challenges with the E&E, is that in any way spilling over to any of the other stuff? Because they have so many programs who
No.
are not able to submit right now, and it's doing some other weird stuff. So I'll submit a ticket, but it's not that. It's something
Yeah,
else.
no, it shouldn't have anything
Okay.
to do with well, I say that, but but you know, sometimes things are interconnected. I don't know of anything else going on with TSQI, ESQI stuff at this point in time. That seems to be working okay. But it sounds like you are coming across a couple of issues. So yeah, definitely put in a ticket.
Yeah, it's like if they do a draft, everything gets lost when they go back.
Oh, is this for ordering, Lisa?
Yes.
Yes, we are aware of this one.
Oh, okay. Perfect.
Yeah, so and it's with all vendors, and they're getting an error message saying to call the interesting thing about this, to call BIU.
Oh.
Yeah, it's funny, but it's not.
Yeah. Okay.
So
As long as you know, that's
yeah,
good.
we're unpacking all of that when I jumped over to all. That's why Danielle's not with us right now. She is working with them as we speak. And so yeah, hang on. It's
We
not
will.
one particular ordering issue, but it seemed like so anyway, Anuj was on the call. He's our main developer who's been working with and he's really, really super smart and super fast with this stuff. So we're hoping he finds a solution really, really quick. Like he's usually like, oh, I got it done within a couple hours. So we'll keep our fingers crossed.
Thank you for this additional information, Karen. Since you're
It was
working
hot off the press, Christy.
Okay.
Otherwise, I would have given it to you in advance.
No,
So-
I am glad that you're here because you've been walking with them through the whole process. You know, I joined a little bit later, so. Okay, I think I saw another hand, Carolyn. Did I see another hand? Maybe.
Um,
And if not, that's all I have.
any other questions about E&E? Alrighty. Cool. Yes, Mary Lynn.
Are the amendments going to have, I forget what it's called, but essentially payment for the people administering the grant, the E&E grant, past December 2024?
That I mean, I've seen other contracts that have personnel included in them, but
Yeah.
haven't gotten into these amendments.
Yeah, Marilyn, you'll have you'll have your administration costs all the way through December of 26, even that we'll cut everything off in September, right, for spending records. But yeah, that's why we're extending those contracts so that you have those administrative funds in your base funds.
Thank you.
Yeah, I'm sure that was a little panicky if you weren't thinking that was the case.
Yeah.
So yes, but that's the exact reason why we're doing the amendments, to make
Awesome.
sure you have those funds all the way through 26.
Right.
All right. Any other E&E questions? Okay, and let's see. Is Beth Melton on? Not yet. Sorry, we're having to do a little bit of rearranging today. That's all right. Connie Z, are you on? I think I saw you on here. Sorry to put you on the spot. Oh, I thought she had hopped on. Okay. Well, we can talk about our QRIS updates. That's something we don't need to wait on, even though we don't really have too many big updates. We were going to just touch base on minor improvement grants. We're sorry that the process is taking a little bit longer. We really wanted to get all of our ducks in a row before we opened up the application, and we wanted to make sure we had all the funding amounts in. We're finalizing that this week. And at which point programs will be able to move in and actually apply for the grant and receive their funding. I wanted to see if anyone had any questions on that, because I know it's a very different process than in years past.
I thought they had already applied.
So we've had programs that have submitted their interest in applying. And then what Lilith and Michelle and I have done is go with that list. And we've spoken with our councils and selected those who are going to move forward with the grant. So we have those selected with the funding amounts. We've had those confirmed. Michelle's finalizing that with her councils. So we do have the list of folks who have been confirmed. So Marilyn, I believe you and Lilith should know who from Boulder is good to go.
Yes. I know, I just didn't realize, I didn't set them up for expecting to have to apply again, apply again. I thought that might be confusing to them.
Got it.
The impression they were selected.
Got it. They are selected. Yeah. When I say application, it just means go through the steps in Salesforce. So thanks for that clarification. Yes, they're good. If we've spoken to you and sent you out your confirmations, then you're good to go. But we just have not transferred the actual funding into the MI funding stream quite yet. And I believe that was our biggest update. Karen, can you think of anything else?
I've been so down in the weeds on this E&E stuff. I'm sorry. I haven't even thought about anything else, but we aren't doing a WIG update today because we are still waiting from the Gov's office to finalize some of our final changes we've asked for. But overall, everybody's on track, and we certainly appreciate your efforts to use your current MOUs to continue to support programs to reach those next levels as outlined. Just keep in mind if we see on our side that rating levels drop, but they're also on our list for having an MOU, we might just be asking you some questions about what was happening with that particular program. That's one thing that we're trying to keep track of a little bit closely, help you guys out on that space. And as we get a little bit more savvy with the system, we'll be able to get some reports for you guys out too. So I think that'll be helpful to help you manage your MOU contracts in those timelines. And then we just hope everybody's doing well. It's been a crazy couple of months, and we know how challenging it's been, but I can give, and I think all of you received the email regarding the RFA process, and I certainly hope that was helpful news. That's what the intent was. So if you haven't seen that, look for that. It went out last week. I believe Tyne sent it out under my name. So good, Gretchen, thank you for clapping. We really we are trying so hard to, those of you especially who are doing the work of LCOs as well as ECCs, we are making very, very, very intentional efforts on our side. Like we're having every other week meetings to really see what we can do to make efficient the processes. And as we get a little closer to this, of course, we'll be bringing this back to this group to have those conversations about, you know, what these, how we can all work together even better. So thanks for all of your inputs so far and your questions that have come up. And remember, our leadership is on those hot topics calls with the directors the second Friday of the week, and no questions should be, you know, you should be prepared to bring those tough questions to that particular session. And you know, there's been some great efforts on their part to really listen and hear what the challenges are and start working on that. So thanks again for also letting us have that time. Okay, I think we have Beth on.
Yes. Okay. I am. Hi, everyone. You all mostly know me here from the Department of Early Childhood with my work with the Employer-Based Child Care Grant. And I am actually here on behalf of the Department of Local Affairs today, who we are partnering with in a consultative role to work on House Bill 24-1237, which is programs for the development of child care facilities that was passed in this past legislative session. And we have some updates and a request for feedback from you all today. Beth, would you like to introduce yourself as well?
Sure. Yeah. Hi, everyone. Beth Melton. I am an early childhood policy consultant, and I am in partnership with EPIC, Executives Partnering to Invest in Children, working with DOLA on implementation of this legislation. And EPIC was also very involved, and I'm sure we talked with a lot of you in advocating for this legislation as well. So I'm just here to back Alyssa up and answer if there are specific questions about the programs themselves.
Awesome. Thank you, Beth. We hope you'll meet the DOLA team working on this at some point too. They just unfortunately had a big all staff event today, so they weren't able to make it. So a quick overview of the program if you're not familiar. This act creates 3 new programs that are going to be implemented and administered through DOLA in the Division of Housing. And as I mentioned before, CDC, myself and Bonnie are serving in a consultative capacity because of a lot of our work with employer-based childcare, which has some similarities. The 3 programs that are being created are a child care facility development toolkit and technical assistance program, a facility development planning grant program, and then finally a child care facility development capital grant program, which is currently not funded. So that one, the policies and procedures are on hold as they're not required until November of 2025. So we have just been working on the first phase of these programs, which is putting together the policies, procedures, and guidelines for the first 2 programs that I've mentioned. And we wanted to make you aware of these policies that we've drafted and collect any feedback that you all might have. We have a really, really short window for this, so I apologize, but feedback is open now and will be accepted until October 28th, since we have to finalize the policies by November 1st. So I have linked this page in the agenda, and I can also drop it in the chat, but the Engage DOLA website is the hub with all of the information that I'm sharing today, drafts of the policies and procedures, as well as a Google form asking for your feedback. And the Google form was set up in a really effective way where you can read a chunk of the policy and then provide feedback on that specific piece. So you don't need to be jumping between a draft of the policies and the Google form. And we hope that assists you in providing really like targeted specific feedback. And then wanted to make you all aware of the upcoming timeline and things that you can expect to hear more about, which is from November to June of 2025, we will be working on the development and implementation of those first two programs, the Toolkit and Technical Assistance Program and the Facility Development Planning Grant Program. And then over the next year, from November of 2024 to November of 2025, the DOLA team will be drafting the policies, procedures, and guidelines for that child care facility development capital grant program, which we also kind of have to wait and see how that develops. Okay, any questions about this program that Beth and I can try to answer, or the feedback form? I think you all may have already gotten an email from ECLA, or will probably be receiving it with some of the same information and the same ask, but we wanted to give a chance for questions too. Yep, so this is a little bit of a different target audience. The EPIC toolkit that we developed with CDEC through the Employer-Based Child Care Program, we have one specifically for employers. And then we've done some work with E&E too, with Thrive. And this is targeted at developers more specifically, but Beth, do you want to add any additional context here on the background or why this program is differentiated?
Yeah, for sure. So the focus with the legislation was really on incorporating childcare kind of into communities, and there's a few different audiences in mind. So developers for sure, especially affordable housing developers, are one focus. We know that there are some resources available to affordable housing developers that prioritize projects that are incorporating childcare, but then the developers say, well, we don't really know enough about incorporating childcare. And so providing some technical assistance and support there, supporting local governments with thinking about how to support childcare in their communities, often, especially in our smaller places across the state, we're seeing local governments that are interested even in being a development partner. So just a little different audience. However, there's also a goal of incorporating the resources that already exist. We know we have the construction guide that CDEC developed. We have EPIC's employer-based childcare or grant childcare resources, etc. And one of the other things that we have heard is that there's not a great kind of place to just send people to where all these resources are housed. So certainly within the toolkit program, I think there's also a goal of just, can we figure out everything that's already out there and give people an easy place to go to find it in one place as well.
Yes, Diane, I think that's a great assessment. And then providing the toolkit, that's kind of an evergreen resource online that we can direct folks to if they're interested. Whereas, you know, the Design Lab was a application-based cohort model. So yeah, really hoping to come up with a comprehensive resource. Great, thanks. We're glad you're excited and we really value your feedback. So please feel free to let me know if you have any questions and take a look at the Engage DOLA website. Thank you all.
Real quick, Alyssa, do you have any updates on the facility needs? Is that still going through our clearance process?
It is still going through clearance, should be in the final stage, but I will be sure to put it in the first newsletter and share it out as soon as I have it.
Yeah, as soon as we know, we'll get that information out to you guys. So, because I know that's a resource that folks have asked for. So thank you so much. And Charlie, I did see Kendra jump on, so we'll go there next.
All right, awesome. Yeah, we have Kendra Dunn on, who's going to give us a little update on some goings on with the CDC. So thank you so much for joining us today, Kendra. Welcome to Stay TA Day.
Great. Thank you, Charlie. Thanks everyone for letting us come talk to you guys today. I wanted to give an update on our preschool development grant Birth to 5 application. The news has been getting out, but we just want to make sure we're getting to everyone and everybody hears. We were notified that we were not selected for a PDG grant. So our current planning grant will end at the end of this year, December 30th of 2024. We are very committed to try to figure out how to sustain some of the work that's been happening with PDG and how to fundraise for some of the things that were in the application. We are happy that the feds have told us that they are hopeful that there will be another round of grants for the following year. So though we didn't get funded for 24-25, there might be opportunities for us to get funded for 25-26. We won't know until they see the budget for that fiscal year, but their intent is that if there is any increase, to kind of reopen that application process for the 10 states that did not get funded in this round. So we'll keep our fingers crossed that is still kind of an out year opportunity. But despite that, we are kind of going through the process of looking at some of the impacts and prioritizing that. An example I can share is the Colorado Department of Early Childhood lifted a Family Voice Council with PDG funds. We're hoping to continue the work of that group with PDG funds. So, now we're kind of trying to figure out, like, how do we remain committed to this and fundraise for it? So we're just kind of in the neck of just in the midst of that right now, of just like going through piece by piece and trying to identify what needs to be sustained with other funding and coming up with that. We thank you for your commitment and collaboration and patience. We know that there were absolutely things that were have been PDG funded for the councils, and that there were ideas in that new application. So just know that we're kind of trying to develop a plan forward right now with that. What I can promise you is that we will continue to communicate. So we will definitely continue to, as we refine that plan and we understand what items might need to be put on the back burner versus what items are we full ahead, going full ahead with or fundraising actively for. We'll be sharing that information for you. So if you have any questions, you can always reach out to me or Mary Alice. You can certainly always send them through Karen and Charlie and others that you guys get to see regularly. And just know we'll keep communicating. It's kind of a bummer to be here today to share not great news. I usually get to come share good news. So any questions?
And Kendra, can I just add something onto that? Like for this group, in 2025 is when we would normally be publishing actually the triennial report for ECCs. And it has been funded with PDG funds in the past, and we were anticipating it would be again, but with the grant not coming through, I just wanted you all to know it will probably look a little different. We're trying to move forward with, some of the data that's been collected, maybe some surveying. It may just look a little different, or we may push it out a little with permission. So I wanted to give you guys that heads up. in case you were, on a more, I don't know, time schedule, especially some of you who've worked with us in the past couple of years to get it up and lifted, you might be thinking, oh, I think it's about time. Although it does feel like we just got it done. Stacy Petty, right? So anyway, just so you guys know, again, we'll keep you updated on that particular topic and just make you aware of where it's going to end up landing, either with an extension or with a little bit different look and feel to meet the legislative intent of that. So thanks so much, Kendra. I appreciate
Yeah,
you.
Sharon, thank you for calling that
Noting.
out specifically. I mean, the one other thing I will say with that is that we know it's in statute, obviously, but we have continued to kind of look at the same things over and over and over. And I think you always look for the silver lining. A silver lining in there might be a discussion about how many times do we have to continually to prove the same things about the impact of the ECCs, and is there opportunity to kind of use this to talk about, like, are there other research questions that we haven't looked at or haven't answered that we would want to answer? And so any thoughts on that? We would love to hear. We are definitely looking to see if we have other projects or funding streams doing evaluation that could take on a portion of this. So it just would be helpful to hear from you guys if there are research questions that you feel like we've never actually looked at or been able to answer in the previous triennial evaluations. Just make sure it's on our radar. Thanks.
Any questions for Kendra? All right, awesome. Yeah, please send your ideas to your QRIS coordinator. We really want to continue the valuable work that PDG has been doing. And we know that in this department, if there's something we want to accomplish, we can always find a way to accomplish it. So we want to work hard to make sure that that happens. So thank you, Kendra. We're hoping to turn this into an opportunity.
Very much so.
All right, awesome. There you are, Connie. Hi. So good to see you. And you're muted, just so you know. I know you haven't been talking yet.
Hi, Charlie.
Hi.
My volume wasn't on, so I wasn't sure I couldn't hear you.
Oh, I was just saying hi. There you are. Good to see you.
It's so good to see you. Thank you so much for having me over to talk about peer mentoring. So I am just pulling up my my slides. I was in another meeting. We're at a retreat here at the DPP offices with my team. So making a little break here to be with you guys. All right. Can you please, Charlie, let me know if you can see it?
Yep. Looks
Okay,
good.
perfect. All right, thank you so much for having me. My name is Connie Zabalaga, and I'm with the Peer Mentor program. And I'm here to talk about a little bit of the work that we've been doing over the last 2 years, where we're at, and where we're heading with the peer mentorship program. So I'm going to give you a little bit of a background of what the peer mentor pilot program is, and like I said, where we're going in the future. So the peer mentor program trains ECE professionals to attain the necessary skills to form a relationship-based reflective process between colleagues to advance their professional and personal effectiveness. Mentors and mentees will get to put knowledge into practice with the support of their peers. So that is what we do. So we have a structure to the program. There is a mentoring cycle that they follow. So they get to have 5 module meetings. The mentors get to participate on. They meet twice a month on the same week for 1.5 hours. So each module is 3 hours long. On weeks 2 of the cycle, the mentors meet with their mentees. They get to connect, set goals, plan next steps. And then on week 3 of that cycle, we meet with all of the mentors to participate in communities of practice where we discuss topics of interest. And then on the 4th week of that cycle, the mentors get to connect again with their mentees to check in, see how they're making progress on their goals, what are their implementation strategies, etc. And then we have that same iteration for 5 months. So during those 5 months, the mentees get to focus on building foundation. The program, they usually start with the positive guidance sequence on the PDIS, and they get to put that knowledge into practice with the help of their mentor. For directors and family childcare home providers, they have access to the director sequence, and they also get to do the same, put that knowledge into practice and reflect with their mentors. After they've completed those sequences, they get to choose their own path. What are some areas where they want to grow, and look for that professional development that supports those goals. Some of the topics that the mentors are learning through the program. So they get to learn about adult learning theory, differences between supervising, mentoring, and coaching. They learn about active listening, appreciative inquiry, cultivating resilience, goal setting. We talked a lot about like using the PDIS as a learning tool, so creating development plans. We also talk about ethics, bias, reflective supervision. We dive deep into our own values, personality types of stress, and really how to build that resilience through stress management. Some of the supports that are built within the peer mentor program, we provide a stipend for participation, besides the hours of training that they get, and also a stipend for substitutes or to pay overtime for those participating in the program. So really trying to support not just the mentors and mentees, but also the program that they work at, so that they can have the time to engage in this mentoring cycle. So currently, what are we looking for as we move towards the future is creating a peer mentor trainer of trainers. And that is, that is something that I'm focusing on and why I'm here today to let you know about these opportunities. So we only have internal capacity to offer 2 cohorts of peer mentor program here at the state. We want to create these trainer of trainers so we can expand our reach of the program and create more supports within the field. So we are going to be needing subject matter experts to guide that process. Yeah, so that's, yes, Julia, thank you. Julia, thank you for your question. So we will be reaching out to councils, and I want to give these information out to you guys so that when the time comes for meeting those subject matter experts, that you know that I'll be reaching out to say, hey, like, we need guidance, and what would be helpful, who would be interested in giving this training out and offering out to the community. So I'll be sending out a survey in the next few months so that we can find out who would be interested in being a trainer, what are the mentorings in each community, and so that we know what should be included in all of these processes. So far, with the impact that we had, and when I say we only have capacity, I'm a team of 1 for peer mentoring here at the state. So far, we've trained 65 mentors in the last 2 years, and I'm starting recruitment for our next cohort. I run a Spanish and English cohort simultaneously, and I do it about twice a year. So it takes a lot of my time. So some of the impact that we've had is we've seen improvement in confidence levels to engage in relationship-based reflective process with their mentees. We've increased the mentees' confidence in their practice, like guiding challenging behaviors, avoiding burnout, engaging with families. We've seen mentors that moved on to mentoring others within their programs. And also we've had mentors who have received like permanent pay increases through their schools because they are the mentor teachers for those teachers that are coming into their program as new teachers. So it's been really beautiful work that I've seen over the last 2 years, and I'm really excited to expand and see this project grow out into the communities. So
You cut out a little bit. Can you repeat the past like 2 sentences? Sorry.
oh yeah, no, what I've said, work grow and expand, and to take it out to the community in the future, to see more facilitators provide these opportunity for teachers and providers. So when is the next cohort and who can participate? So it will start in February of, that's 2025. I messed up my slide there. We're so close to the end of the year. So yeah, next February, so next year, we will be starting recruitment for cohort number 4, and I'll begin at early November. So who can participate? Teachers working in licensed programs, licensed family checker home providers, center directors, assistant directors, and how it works. Some of the eligibility requirements, they just have to work at a licensed program, have at least 3 years of experience in the position that they will be mentoring. So if they're a preschool teacher, and they want to mentor another preschool teacher, they should have at least 3-year experience in that position. If they are an infant teacher, the infant toddler teacher, that they been in that role for at least 3 years. Have a mentee that works in their program. That is only if they are teachers. If they're directors, this is going to be the first cohort that I'm going to try to connect new directors with director mentors, so they won't be working in the same program. So this is new for cohort 4. And the previous cohorts, the directors have been mentoring their assistant directors. For family childcare home providers, they should have a mentee within their city or county. Usually I'm able to be a matchmaker, and I try to find other providers within their city and county that they can mentor. But if they already have that connection with someone and they applied to the program knowing who their mentee is going to be, that's even better. And then support from the program leadership. That's always really important with these programs. They can really be committed to the time that it's going to take to participate for the 5 months. And I think I have a question in the chat, and it says, is licensing compliance history considered? I have not considered that in the past. I think that we really want to build supports within programs. So even if licensing compliance isn't perfect for a program, but they're willing to work and improve, I think this is actually a great opportunity for that. We talk a lot about best practices through the PDS courses. So putting that knowledge into practice, I think it would only benefit a program if they're having issues with licensing compliance. So how do participants apply to the program? We will send out a flyer to all licensed programs, and it will have instructions on how to apply through the Colorado Shines website. The program dates will be included in the course listing. I encourage those who want to participate, if the dates do not work for them, just to think about it maybe for a next cohort, because it is a requirement to attend all of the courses in order to get their peer mentor certificate. All mentors should have identified mentees at the time of application, unless they are a director or a family childcare home provider. So with those, we will be working together to find their mentees. And I think that is all that I have for you guys. Do you have any questions? Diane?
Yeah, you said that you were going to send this out to all the programs, but you'll send it to us as well, won't you? So that we can, boost or follow up your information.
Yes, absolutely. And I can connect with Charlie to get all of you guys' information. So when that flyer goes out, I make sure that I'm also sharing with the councils. Thank you. Any other questions for me? All right, I think we're good, but thank you so much, Charlie, for allowing me to present about peer mentorship. And if there are any questions, my email is right there. If you have anyone who is really eager to be part of the subject matter experts, in helping us create the trainer of trainers. You can reach out to me and say, hey, Connie, I really want to be part of that group. I'll be more than happy to connect with you. And I'll appreciate all of the knowledge that you will get to share with us.
Awesome. Thanks,
Okay.
Connie.
Thank you.
If you don't mind sharing the presentation with me, and I'll make sure it gets sent out. And just a huge shout out, oh, Diane, real quick question. What's up?
Sorry, this isn't a question. I just have
Oh.
to say, I've been in, education for 400 years. And the research behind any kind of mentoring related to peers is so powerful. I just want to say I'm so glad we're doing this. And Connie, I really hope that we need to have more than one person who's doing this, because you're going to die. You're not going to die, but you know what I mean. So I am really excited that you have an opportunity to expand it. And I just want to put a plug in. I mean, if I was younger, I'd be going for it, but I'm getting too close to retiring. But it's just really important. And I just had to say that. So
100%. Yes.
Yeah,
Thanks,
thank you
Diane.
so much.
And just to continue the shout out, Connie was not handed, but she received this position as a temporary position back in 2020 when this was a stimulus activity. She worked so hard to turn this into a sustainable, workable program that is now a cornerstone of one of the services we provide here at CVEC. And it's always just been Connie. So we're so grateful for you that you've continued this program. Like Diane said, the best way for all of us to learn is to teach and to learn from our peers. So please take advantage of this. And again, we're so grateful that you've done this work and have put your whole life into making this a sustainable activity for us here. So shout out to you.
Thank you so much. Yeah, I'm really happy that we get to keep this program and continue to grow. So thanks.
Awesome. All righty, cool. We're somehow back on track. I think we're gonna get off a little bit early today. But we are going to have Elizabeth. I believe you're on. I think I saw your name.
Yes, hello.
Cordova. Hi, how are you?
Doing great. How are you?
Doing good. Cool. All right. I'll give you the floor.
Sounds good. Hi, everyone. If I've not met you before, my name is Elizabeth Cordova, she, her. I work with Teach Colorado as the Early Childhood Program Manager. And some of you might be really sick of me, so you can just go get a cup of coffee if you're like, yes, I know about the toolkit, lady. I want to just start before I dive into the toolkit that I'm going to share today by explaining who we are and who we aren't, because we are often honored to be confused with the Teach Early Childhood Scholarship with ECLA, but we are a totally separate organization who kind of stole the name. We didn't really try to steal it, but we are separate organizations who collaborate closely. So Teach Colorado is in its 6th year of serving the state as really a platform to assist with recruiting teachers. And our platform is all for free. People who sign up on our website have access to lots of free tools like one-on-one advising and lots of how-to guides and financial incentives. It's all based on research that we've done around barriers to entering the profession and then how we can provide assistance to people who are interested in becoming teachers, but may have financial barriers, other barriers in front of them. So that's who we are and the general work we do, excuse me, if you're not familiar with us. And we have been working on a special project for the past year and few months with CDEC on creating a set of assets that folks can use in local communities to assist with recruitment. So I will kind of dive into what you will find in the toolkit, and I'll also provide you, let me just click off here and give you a link in the chat. So the toolkit is there in the chat box and is focused on 5 main recruitment messages. The first is really just early childhood teacher recruitment. And the goal, if you click into the tool, you'll find all of these images that are downloadable in various sizes, depending on your social media or website needs. But the goal is that you don't have to create anything and you can just pull these images as needed if creating some sort of recruitment flyer or a website or an online event, etc. And you'll find in the website or in the toolkit that there are sample captions that you can use if you are indeed sharing some of these on social media. The goal is both to make it really easy for you to just hit copy and paste, because everybody has a very full desk and is doing many jobs at once in early childhood. And yet we also want you to be able to tailor it to your individual community. And so there are some light suggestions in there on how you can do that. You certainly don't have to use the images alongside the captions that we have created. You can use them in whatever way serves you best. So that's the first message, early childhood teacher recruitment in general. And then there are some resources that are especially focused on available financial supports in early childhood education. I want to acknowledge the irony of this moment, given that we have seen the disappearance of many financial supports that did exist a year ago. So that's a difficult acknowledgement to make, but anytime you are promoting a scholarship, other financial incentives, or the tax credit, these can certainly be used as well. The next bucket is promoting early childhood substitute teaching, because we know that's absolutely crucial for centers and districts to be promoting. I should mention that the folks you're seeing in these images are early childhood teachers in Colorado, so we're happy to feature their important work. And then the last two are kind of bucketed here. One is just focused on the essential role of early childhood education in Colorado, and the economic significance, and then promoting specifically the compensation and benefits task force report recommendation, just to elevate those in the community. So this is especially one that can be used with community partners when, partnering with businesses or other organizations to just promote early childhood education as a whole. So I'm going to skip ahead and then come back to some of this. There are 2 flyers linked in the toolkit as well, one in English and one in Spanish, which really just summarize the tools that Teach Colorado can offer, again, all for free. So these are great to hang up in teachers' lounges or to a job fair or anything like that, but can certainly be utilized in whatever way is useful. And then you'll find that the toolkit also now features a series of 5 videos that were, the footage of which was taken in Colorado. So they're all recruitment, they're just a couple of minutes long. And again, there are sample captions in the toolkit that you can use if promoting on social media. Again, certainly tailoring to the individual community or the provider's needs. Or you could pop one of these into a presentation if you're, again, presenting at a job fair or something like that, community event. So you'll find all of those in the toolkit. I want to point out one more resource in the toolkit, which is a web referral link. So if, say, a provider has a jobs page and really wants to capture the contact information of someone who's maybe interested in early childhood, but isn't yet qualified or isn't even sure how to qualify, we have found that adding a Teach Colorado link there can capture that person's information. They sign up on our platform and we can provide a unique link to the provider or the organization so that we can say, okay, we're going to send a follow-up email about a job fair happening in this county to anybody who's from this provider's jobs page, for example. So there is sample web referral link in the toolkit itself, and there is a link there, but if your organization wants to use one and you would like one that is just unique to your page, then please let me know. I can easily create that. And then we can track who has come to our site from your page. If you do use any of the assets on social media, feel free to tag teach.org and we will then elevate the post again. We'd love to repost it, especially if you're trying to reach just community members. And then we can also create tailored emails for any kind of programs. I have, for example, worked with a substitute agency on who didn't have time to follow up with each person who had but did not qualify. And so we created emails that they could send out, like a template to say, thank you so much for applying. You don't meet requirements, but to learn more about how to qualify, you can sign up with Teach Colorado, so that we can hopefully at least capture those folks' interests and then help them become qualified to teach early childhood. Let's see here. So the toolkit is a living document. Right now, all of the assets there are in English, but soon we will be adding them in, I actually have a slide for this, Arabic, Farsi, Karen, Somali, and Spanish. So if you bookmark it, back to it, you will find more linguistically diverse resources. And then there are kind of two ways that you can utilize. One is you can just use it yourself if you want to be adding some images to freshen up a web page, or some of the financial incentives that Teach Colorado has. Or if you really just work to support childcare providers and community members and want to elevate the toolkit itself, you can certainly share that, whether it's via email or LinkedIn or whatever it may be. So I am always available to help with specific recruitment challenges or needs, and I'll put my email in the chat, but I will stop here for any questions. All right. Well, please feel free to get in touch. We hope you'll either bookmark the toolkit or check back on it sometime soon so that you can find those translated resources. And if you ever need a brainstorming partner on how best to utilize these, we're always happy to help. And thank you very much for having me.
Thank you, Elizabeth. And I put that toolkit in our agenda. So you all have access to it from there as one avenue. And then if you don't mind sending me your presentation, I'll make sure to link that in our agenda as well. Wonderful. Thank you so much for the presentation. I know this is something that I get asked about all the time, and it's so nice to be able to offer up some new opportunities. Ooh, and now you're going to be on a podcast? Oh.
I might be a
I know,
return
exciting.
guest. We came and chatted a couple years ago. So that sounds great. Thanks, everybody.
Cool. Next up, you'll be in our CDC TikToks. Cool. All right. It looks like we have just one more presentation today because we had one cancel, and that is Allison Hargarden. I think I saw you sign in here.
Yeah, hi Charlie.
Hi, Allison. Good to see you.
Likewise. Should I just go ahead and share my screen?
Please. Yeah, take the wheel.
Okay, let me. All right. Hi, everyone. Thank you so much for having us. I am Allison Hargarten, and I am with Healthy Childcare Colorado as the Director of Mission Strategies. And I'm joined by Robin. Robin, I might just have you unmute and just say a quick hello as well.
Hello, everyone. We're really excited to be here today and share this information. Thank you for having us.
Yeah, really excited to share some updates on the two-year project that Healthy Childcare led related to pyramid model training, coaching, and scholarships. We all know that the COVID-19 pandemic continues to still have implications on our workforce, on our early childhood settings, on our systems, children and families. And so we're excited to share some of the outcomes that came from this two-year project, which was run from July 1st of 2022 to June 30th of 2024. So really in the midst of that pandemic. Okay. This 2-year project was funded by the Colorado Department of Early Childhood through ARPA stimulus funds. The funds were sort of in the bucket of Strategy 3, which was Family Strengthening, Activity 4, Health and Mental Health Grants, specifically in that domain of training and coaching. So these grants were designed to improve the well-being of childcare providers and families, to support and facilitate a positive, engaging, and reciprocal caregiving environment for children. I'll share a little bit more about pyramid model, evidence bases and such, but we were very confident that the pyramid model would really help address some of the things that we were seeing related to the COVID-19 pandemic. And what we didn't fully anticipate was the impacts that the project would have on the worth, resilience, and retention of our early childhood workforce. And we'll get to those in just a moment. Okay. I know we have a pretty eclectic group here today. My guess is that some of you are really familiar with the pyramid model and this triangle, and there might be some who are less familiar. So just to sort of level set, let's talk a little bit about what pyramid is. The pyramid model is an evidence-based framework that supports young children's social and emotional development by helping early childhood professionals create positive, inclusive, and nurturing learning environments. So it really builds upon a tiered public health approach with that effective workforce, that yellow section, being the foundation of the model. And that's really where this grant project was living, right? To really elevate the workforce, make sure they have what they need, particularly in this time of crisis. So when systems and policies are in place, our early childhood caregivers can adopt and sustain the evidence-based practices that support promotion all the way up to the top of the pyramid, which is intensive intervention. And one thing that makes the pyramid model particularly unique is that anybody can implement the strategies that make up the pyramid. It doesn't matter the language you speak. It doesn't matter where you're supporting children. It doesn't matter your past experience. Truly anybody can implement these strategies. And we know that during the pandemic, all caregivers really needed support in elevating their own well-being, along with the well-being of the children in their care. And so it made, the reach and the impact particularly unique in this project. The pyramid model has a strong evidence base and has been evaluated and found effective in improving child outcomes. Research shows that when caregivers are trained on and successfully implement the pyramid model, children show improvements in their ability to manage and control their behavior. They demonstrate fewer behaviors that adults find challenging, and they build stronger social skills and demonstrate an increase in positive social interactions. We also know that when caregivers, providers, teachers have the skills and knowledge that they need, they also come into the classroom, into their caregiving environments with more confidence and more excitement to do that job day in and day out. So we'll talk about some of those outcomes really related to the workforce as well. So this 2-year project focused on 3 key components of the pyramid model. The first was to increase access to pyramid training. The second was to increase access to pyramid coaching. And the last was to increase access to pyramid facilitator certification, which is the pipeline to becoming a pyramid model trainer and coach, which we also call a pyramid facilitator. So really that pipeline to be able to provide this training and coaching more so across the state. And we'll dive into each of these individual components in more detail as we walk through today. So starting with that training component, the goal of the training project was to increase equitable access to pyramid model training by providing caregivers across the state with the 45-hour Pyramid Plus approach training, which is recognized as a training of special recognition in the PDIS. This training can cost upwards of $500 or more for providers to take, and we know that that can be a huge barrier. So we're really excited about the opportunity to be able to provide this much needed training to providers at no cost. In addition, the trainees received an $150 stipend and a pyramid model teaching kit upon successful completion, which really allowed them to take these skills and go implement them within their learning environments. So Healthy Childcare Colorado partnered with 20 training partners to deliver 37 trainings, 4 of which were delivered in Spanish, to 867 professionals across the state at no cost. We could not have done this project without the support and partnership of those training partners. So a special thank you to anyone who helped support this project. And I see a few names that I recognize here today, so thank you all. Our training partners included 17 individual facilitators, 2 of which were Spanish speaking, and then 3 nonprofit organizations, 2 of which were early childhood councils, and they just really employ these facilitators. All right. And these trainings resulted in some pretty incredible reach. And so through this project, we were able to reach 11,631 children. 73% of trainees indicated that they worked with preschoolers, and another 63% indicated that they worked with infant toddlers. So we were really excited to be able to provide this training and skills to providers who really supported children across that early childhood age range. And you can see who was trained. So we were able to reach providers truly statewide, reaching from the Western Slope all the way over to the Eastern Plains, across 34 different counties in Colorado. So we really did have that statewide reach we were hoping for. As you can see here, in terms of our trainees, those that were trained in the pyramid model, roughly half identified as BIPOC, with the majority of persons trained working within licensed childcare settings. We can see here that there was a bit of a gap in being able to provide this training to license exempt or FFN communities. And Healthy Childcare is actively engaged in efforts to bring pyramid model training in particular to our family, friend, and neighbor community. We know, again, it can be implemented by anyone and that these strategies are really effective no matter the setting. And so hoping to provide more updates there soon, but really excited to bring this training to more FFNs in the near future. And similarly, we were able to train folks sort of across different jobs or roles within early childhood. So you can see the majority were teachers or directors, but we were also able to provide this training to others such as support staff, to aides. And it really does, when you're able to get this information into the hands of a variety of roles, it really does create that culture change, that sort of systems change, and creates a more sustainable environment for social and emotional development. So what are the outcomes of delivering 1,665 hours of evidence-based social and emotional training? They were pretty awesome. Like I said, we were confident that we were going to see a significant increase in participants' knowledge and skills. So you can see here that 97% or more of trainees indicated that they learned critical research and evidence-based social emotional strategies. They recognize and reduce behaviors they find challenging and concerning. It supported their ability to use tools and resources related to social emotional development and well-being. And it helped them recognize, reflect on, and begin to address the impact of bias. And we know that that last one, when we're talking about keeping children in their learning environments, reducing suspension and expulsion, that last one, to recognize and reflect on our own biases, is so impactful. But what was possibly even more compelling and exciting for us was to see some of the outcome data related to worth, resilience, and retention. You can see that 97% of trainees indicated that this training increased the overall professionalism and worth in the workforce. It improved their program culture related to social, emotional, and mental health needs. And it kept their childcare programs open and operating. And we know that all of these were huge components of maintaining a system of early childhood that we needed, particularly during the pandemic. And while these outcomes are hugely important during the pandemic, they continue to be extremely relevant today. So based on the recent Kids Count data of childcare providers surveyed in February of this year, over half reported that they were more burned out than this time last year or the previous year. And 62% reported that at least one childcare center in their community had closed in the past year. So just really highlighting that these outcomes continue to be extremely relevant today and are still very needed. We have numbers to indicate the power of this training, but I wanted to just pause and highlight a few of the quotes that were collected from participants themselves. So I'll just give you a moment to read those. So it really just does highlight the impacts of this training on provider stress, burnout, and retention. And I didn't mention this at the beginning, but please, if you have any questions as we go through, drop them in the chat, and I'm confident we'll have some time at the end to get those answered for you. Okay, so moving on to the coaching component. This was that second component of the project. And through this, we aimed to increase access to pyramid coaching by offering 10 or more hours of coaching to teaching teams across the state. Coaching was available to any program who had a minimum of 20% of their staff having completed the Pyramid Plus approach training. And as part of this coaching, coachees did receive one observation using the TPOT or Tippy Toes tools. And programs also received a pyramid teaching kit, the Unpacking the Pyramid Model book, and a $1,500 stipend for participating in coaching. So again, Healthy Childcare Colorado partnered with 23 coaching partners to deliver coaching to 157 professionals across 53 programs. Just as before, we could not have done this without our coaching partners. So thank you to those of you who are either here today or just in extending a thank you to those. The majority of our coaching took place in preschool settings, with approximately 1/4 being in infant toddler settings. So again, we were able to provide that coaching across that age range again. All right, and through the coaching component, we were able to reach nearly 800 more children, bringing the total children reached through this project to just shy of 12,500. And while that is truly an incredible number, it encompasses less than 4% of the children under 5 years in Colorado. So we know that there are a lot more children out there who would benefit from their caregivers learning these skills. Again, coaching was provided in a variety of settings, with the majority being licensed childcare centers. And coaching was also provided in 53 programs across 19 different counties, both rural and urban. And you can see there in the chart at the right is the list of the counties that were served through coaching and the number of programs. All right. And the outcomes of coaching were similar to that of training, with the grand majority of our participants indicating that coaching improved their ability to learn critical and evidence-based social emotional strategies, recognize and reduce challenging behaviors, use those tools in the classroom and other learning environments, as well as supported them in recognizing, reflecting on, and beginning to address the impact of bias. And again, we saw some pretty astonishing outcomes related to the worth, resilience, and retention of our workforce, with pyramid model coaching effectively increasing overall professionalism and worth of the workforce. we saw a little less of an impact on it resulting in childcare programs staying open and operating. And we attribute that to sort of the intensity or the nature of coaching, right? In order to really invest the time and dedicate the time to have your coaching teams go through an ongoing coaching experience, you really have to be pretty established and settled. So it was likely that many of the programs that we provided coaching were not at risk of closure. And again, just sharing a few quotes from those who participate in coaching to sort of help humanize and contextualize the project. Okay. And the third and last component of the project included the facilitator certification scholarships. Healthy Childcare Colorado aimed to increase access to Pyramid certification, which is a 10-month program designed to support professionals to improve and build the capacity of state systems, communities, and local programs to implement the Pyramid model. So those who complete this intensive training program are then certified to train and coach the Pyramid model, expanding its reach and access to these essential supports. Through this project, we were able to award 28 scholarships and disseminate $168,000. So that means 28 new individuals were able to go through this 10-month intensive training program at no cost. This is a map of the counties where scholarships were awarded. So those obviously who go through this program and become facilitators are then able to take Pyramid model coaching and training back into their communities. So the idea here is that these counties now have more access to training and coaching, while also knowing that many of these training opportunities are virtual. So really expanding access for everyone across the state. And again, here's an account from one of our now facilitators who went through the 10-month intensive program using an ARPA scholarship. All right, so now that we have the data that really shows, the more local or statewide impacts and outcomes of Pyramid model training and coaching on our workforce, our children and our families, what can we do with it? What's next? So there have been 2 recent strategic plans released in Colorado, both of which have been endorsed by the ECLC, that outline the need for resources and supports with these exact outcomes. So we're going to just sort of connect some dots here as we talk about this in terms of the broader conversation around early childhood right now. The first of those plans is having trouble going to my next slide. My notes. Is the Colorado Early Childhood System Strategic Plan, which was recently released. And you'll see here a few of the different goal areas that we feel the outcomes of this training, coaching, and scholarship project really lean into. So the first is promote whole person health and well-being. And again, we know that the Pyramid model really supports not only focusing on child's ability to learn, but really that social emotional development, equipping our providers with the skills to foster that whole child well-being. The other goal, or goal number 3 on this list, is to support learning and development. And again, when we talk about learning and development in early childhood, it's not just academic. It is very much so that social emotional component. And lastly, that goal number 5, which is to support the early childhood workforce. We have been hearing about this over and over. The data shows it. I know you guys are all out there doing this work and hearing it every day, but we're in what some might call a bit of a early childhood workforce crisis, right? People really still feeling those implications of the COVID-19 pandemic and beyond. And so just knowing that this training not only increases knowledge and skills, but also that worth, retention, and resilience is one way we can begin addressing that goal 5 of supporting our early childhood workforce. And then I assume this is familiar to everyone here as well, but the Colorado Comprehensive Early Childhood Workforce Plan, which includes 4 different anchor themes. And while the pyramid model really does lean into some ideas around recruitment and career pathways, what we really want to draw attention to here is that retention and wellness, so that green circle. We know that retention, wellness, our own mental well-being will keep us in the workforce, keep us there for the children, for the families, and doing good work. And we can help our teachers, our providers, our caregivers by equipping them with the skills and the knowledge that the pyramid model provides. So in terms of sort of continuing the momentum, and the reason that we're here sharing this with you and many others today is one, to build awareness of the pyramid model and its impact, encourage you to talk with those in your community about the pyramid model, find out who your local or closest pyramid model facilitator is, connect your programs that you see a need for this with pyramid model, either by outreaching us at Healthy Childcare or outreaching a local facilitator in your area. As sort of statewide entity and systems, really identifying opportunities for further investment. So like we said, we know that this training and coaching has a very positive impact. We also know that it can be a bit cost prohibitive. So how can we find sustainable funding? And we encourage you all to take this information into your local communities and see if there are opportunities to fund this at the local level. And I know at Healthy Childcare and with our various partners across the state, we're going to do that same thing at more of the statewide or state and national lens. And lastly, because this works, to really expand implementation statewide, get this into more people's hands, keep our educators feeling resilient in their workspaces so that we can be there for our children, families, and communities. And if you're interested in learning more about the pyramid model, or in particular this project, we just released our Pyramid Network Hub Impact Report that really highlights a variety of accomplishments in the pyramid world across Colorado during the last fiscal year. So feel free to pull that QR code, and we can also drop the link to that report in the chat. All right. Leave a ton of time for questions. So I don't know if Robin, if you saw anything come through, or if anybody would like to unmute and has any questions.
I think the biggest thing is there any chance to get more additional funding to provide? Diane, thank you so much for that question. And as Allison said, we're thinking very forward. We are writing for things, and we're hoping to hear more, but we really need additional opportunities and appreciate anything that locals can do to try and fund programming in communities as well. Allison, did you have anything to add to that?
No, I mean, it's definitely a huge topic of conversation. I think right now we're just trying to build that awareness component, right? Get people talking about pyramid, talking about these outcomes, and really tying it to those strategic plans so that we can move the efforts of all Coloradans forward. But yeah, it really is going to take some local support as well as state and national support. And so encourage anybody interested in that to reach out to us, and we'd love to connect and collaborate more.
I think that's it from us, Charlie. We can promise to get you this PowerPoint so you could share it out to everybody. And we really, really appreciate your time and your attention, everybody. Thank you so much.
Thank you. Wow, that was such a wonderful presentation. Amazing work that you're doing. It's benefiting our early childhood community in ways that we probably won't even understand until these kids are much older and might even have kids of their own. I mean, that's the beauty of Pyramid, is that it's a lifelong, it's lifelong learning, and even generation long, where you learn these things as a kid, you teach them to your kids. It's our template for being a person. So we really, really appreciate the work, and we really appreciate you guys coming on today. Yeah, please share out that presentation. I'll make sure it gets to everybody. There we go. There's the impact report. So I'll put this in the agenda as well. And I believe that was our last formal presentation. We have some time here if anyone has any additional questions, celebrations, anything they'd like to share with the greater community. We're happy to take any of those. And again, I just wanted to say thank you to everybody for your patience as we're pulling in our new QIM system. I know it's been a kind of a rocky launch, but I always say on the plus side, I haven't heard a lot from providers feeling overwhelmed by the system. So I think that's a good sign that they're feeling comfortable in there. And we just got to worry about it on the back end. But just know, keep reaching out, know that we're busy ironing out all the wrinkles and making sure everything works. So we really appreciate everyone's flexibility and support as we're getting that system off the ground, finishing out E&E, tackling some big things here, some big changes. And Karen says, happy Halloween and happy birthday to all the October babies, including yourself, Miss Ann Bowden, whose birthday is on Halloween along with Tyne. So happy birthday to you too as well. Anything else for the greater good before we close out today? All righty. Well, thank you all so much. I hope everyone has a wonderful weekend. And oh, one more thing. Happy I remember this. As our tradition, the next 2 months are going to get a little bit crazy with the holidays. So we are going to reschedule our November state TA day, I believe, or we're going to do a combined November, December state TA day. And I believe we're doing it the first week of December. So it's going to be, instead of having a November and December state TA day, since both of those fall on our holiday weeks, we're going to be doing it Thursday the 5th. I'll update the November invite. Yeah, Heather, what's up?
I might have missed something in my mailbox, but are we going to get a communication about the new invoicing process with some
Yes, I believe
guidance and stuff?
Yeah, Heather, I was just asking about the timeline to our finance team. So it'll be very soon, I think, probably by next week, because they're going to be offering some office hours. And I think a few councils, I think I saw one from Diane who shared the email. A few councils maybe have received just like hey, you're part of we're going to have this new invoicing process if you have an account with the state of Colorado. So maybe look for that. If you still aren't seeing it, we can follow up. And I think there's just going to be more communication, because they also they're going to offer some training time and things for folks to get online and just bring questions forward. Yeah, I agree, Diane. It'd be really helpful to have that. We're really we're learning this ourselves. And so it's always helpful to have the experts who worked on this system. Hey, I did find out, this is kind of cool though, ECLA was one of the vendors who was in the pilot. So I talked to Megan a little bit about what her experience was, and she said actually it was really pretty easy. It's just kind of getting used to going into that link versus the email. You got to input like your name, and just don't forget to put your coordinator in as your CDEC contact. That's the biggest thing, to make sure it triggers the approval processes quicker. And so, but if you're struggling at all with that, just reach out to any of us. We'll help you, or go to the office hours, or so hopefully information coming soon. Thanks for bringing that.
Mm-hmm.
So
yeah.
I'm wondering if you guys would like to just take on a few more new processes. Because you've just had nothing to do lately. I just,
Well, right. Yeah, we're just gluttons for punishment, actually.
Diana, it just sounds like a typical Thursday to me.
Yeah.
And we want to learn all these new processes first, so that way they'll be old, and then we'll start over. Then they'll all be new again in a
Yeah,
few months. So.
if nothing else, there is consistent change, right? So we can
Yes.
all count on that for sure. Anyway,
The
take
only-
care of yourselves in all of this change that we're all experiencing right now.
Yes. Yep. And know that we're here. Michelle, Lilith, and I are here to support you in any way that we can. Like Karen said, reach out to us on this new process. And just remember, we are and it asks you for the point of contact. We're the ones you want to put in, Michelle, Lilith, or I, so that way it'll get routed to us. But I'll try to get finance on here to present at our December 5th State TA Day to answer any questions, because at that point we'll just have been starting this new process. So
Right. And also, if you're just feeling overwhelmed at that point in time that you're submitting your November invoices, do it through the invoice email box. If you don't want to go there this month, just don't do it in both places. So, but I understand it to be not too taxing. Again, if you find yourself just backed against the wall, use your existing process.
all righty, everybody. I'm looking forward to seeing you all then December 5th. So happy Thanksgiving. Happy
Oh my
Halloween.
gosh, that's right. That's crazy to think.
Yeah, and I hope everyone has a wonderful weekend. We appreciate you all so much. So thanks for joining us today.
Thank you.
All right. Talk to you all soon.